This is the morning brief from the Economic Times.
Coronavirus's weakness is soap.
After a couple of days, you'll start feeling better, but then it comes back even worse, which is kind of like a trickster virus.
I don't want to get it, and I don't want my family to get it, and I hope they find a cure because it's going to be very hard.
India is yet to safely reach the shores after being battered by the second wave of COVID, where we saw cases go as high as 4 lakh a day. But with cases gradually coming down, there's now talk about a possible third wave and when and how that might play out. And this is not just in India. A top scientist in the UK, which is supposed to unlock on June 21st, recently said the country is already in the early stages of a third wave. The situation in India is, of course, very different, but whenever there's talk of a third wave, one of the first questions that are asked is whether children might be disproportionately affected. This might be because there were more children who were infected this time, and the fact that there's no vaccine approved for kids in India yet, unlike in the US. But one thing is clear, parents are a very worried lot.
There's so many concerns. Firstly would be she does suffer from, bouts of wheezing every now and then. It's not often, but, it's something we take her to a hospital if it gets bad. But for the past 1 year, it's always been a concern. And, if the hospitals are full and with the third wave coming, another concern is, the hospitals, I hope they are prepared for the third wave, especially for children. They're saying it's really going to affect them. And I hope the government will be prepared.
That was Kamakshi Vella, the mother of a 7-year-old in Bangalore who shared her concerns about her daughter, and she is hardly the only one. In fact, there are parents who are so worried that if they have the option, they're trying to spend the summer abroad because they feel their children might be safer there.
My sister-in-law lives in the US and we keep talking, and the kids there are going to school. The systems there, I feel, are better. Because current situation, what we have seen in the second wave in Delhi, I am petrified.
Very understandable. So is there a chance that if the option is available, you would extend your stay in the US?
Yes, as far as I can, if I go there, if I'm able to, because the schools are online, so one can do that from anywhere in the world. So if the options like that are available, I'll be the first one to take it, just because primarily for my kids' safety and security, especially when you don't know what's coming your way and how would you want to react to it. It's going to be safer if you're there then.
That was Simran Segal, a parent of 2 children below the age of 10, who is located in New Delhi and who you just heard talk about her plans. But to what extent are these anxieties and fears about children justified? You're listening to the Morning Brief from the Economic Times, and I'm Indulekha Arvind. I spoke to Dr. Rakshay Shetty, Head of Pediatric Intensive Care Services at Rainbow Children's Hospital, to get a better handle on the situation. Dr. Shetty, we saw a lot more children affected by COVID this time around compared to last year. So do parents need to be worried about how a possible third wave might affect children? Is there reason to think that they might be worse off in any way than they are currently?
Now, if you were to look at the data internationally, as of now, even those countries which are far ahead of us in terms of, say, Italy or UK or US, who had a first wave and second wave earlier than us, there is no indication to suggest that children would be adversely affected. It's true that the number of children who got affected this time was higher, but that's infection, right? So we have not had children who has been seriously infected far more higher than first wave. So the number is large, but then they have not been affected the way young adults got affected this year. The number why the children got affected more is particularly because when we came this time, the variant of the virus which got affected was highly contagious. So obviously the number looked large, but thankfully for the most part, it's been a mild illness.
In fact, that's what I was going to ask you, doctor. I mean, even in the current surge, were most of the cases, say 90% or so, were they mild or asymptomatic?
That's absolutely true. I mean, we had close to 180 admissions. If you look at our own admission data, I mean, this is the patient who got admitted to the hospital, and we used to roughly see around 30 to 40 on outpatient basis. And for most part, our experience has been that the fever lasts for 3 to 4 days at the best. Some children have loose motions. The children who got admitted are the ones who are very young. Some of them had poor feeding. They were admitted for a couple of days. Some of them because of anxiety. And a few adolescents who are on when the weight being on the higher side, they did get admitted. They did have pneumonia. But then the way it behaved was completely different compared to adults. It's been far more milder illness, thankfully. And many reports, even when you look into those children who died, it's not actually because of COVID. They came with some of the problem. Incidentally, COVID also was positive in them. So children who got really unwell generally had some kind of comorbidity, like a neurological disorder, developmental delay, though they became quite unwell. But then even in them, our experience has been that they've recovered quite well.
But what about post-COVID complications like multi-system inflammatory syndrome that was a concern in a few cases?
देश भर में कोरोना वायरस की दूसरी लहर का कहर तो छाया हुआ है। उसी बीच बच्चों के ऊपर एक खतरा मंडरा रहा है और वो है MIS-C सिंड्रोम। ये जो सिंड्रोम है, जो बच्चे हैं 18 साल के नीचे जो हैं, खास करके जो 8 महीने के हैं, 6 महीने के हैं, उनके ऊपर कोरोना वायरस अगर उन्हें हुआ है, इन्फेक्शियस है वो, उसके बाद MIS-C सिंड्रोम देखा जा रहा है, जिसमें उनके जो लंग्स हैं, उनका पेट है, उसमें तकलीफें महसूस की जा रही हैं और उनका जो चेहरा है सूजा जा रहा है।
I think that's the concern, more than the acute COVID. This particular part, what we call as post-COVID syndrome, like what you mentioned, we call it as MIS-C. That is a concern. Now, what happens is we just don't know why it occurs, but then we think it is probably because of body's own immune response. And this can roughly occur 2 weeks to anywhere 6 weeks from an acute COVID infection. Now, the incidence, it's again, we should not go with the mistaken belief that it's common. It probably happens in 1 in 10,000. But even when you say 1 in 10,000, the sheer population of this country, now, in all the waves across the world, we have seen this occurring almost a month, a peak of MIS-C after the first wave or the second wave. And we've started seeing a steady rise. At least 2 to 3 children every day get admitted with MIS-C in our hospital. And again, for most part, MIS-C is a disease which can easily be treated. There are specific protocols. 99% of them respond quite well, provided they get a timely and early care. The issue has been the recognition and knowing.
Are parents also concerned about the third wave and its effect on children because there is no vaccine authorized in India for children yet?
So I think what parents should right now be looking for is, any new onset fever now, rather than third wave, because like I just said about MIS, it's about early recognition. So how to recognize MIS is important, I think. Any fever which persists beyond 3 days, very high-grade spiking fevers, any red eyes, rashes, tummy aches, vomiting, loose motions, these are generally signs of MIS-C. Now, with regards to third wave and the role of vaccine, now we should know that, the concern about vaccine are twofold. One, we are talking about a condition in children whose impact has not been demonstrated to be a lethal or a difficult disease like what we saw in adults or elderly people. And then we have this concern where it is not related to the virus itself, but its immune response, right? So what we don't know is whether the vaccine also leads to MIS-C. Second, what are we trying to prevent? Because this illness itself has been a mild illness. So is there a merit in actually preventing a mild illness? But from epidemiological point of view, probably vaccinating children is important. The reason why is that important is because, what is going to happen probably in the future is you're going to have people who are 18 plus vaccinated or contracted natural disease and are probably immune. That means the only host left for the virus, it is also a survival game for virus, right? Now, even though children might not get affected seriously like what we're seeing now, but then it can become a potential source for future mutations and then again reinfect adults. The immunologists also feel that probably the MIS chances, is probably less with the vaccine compared to natural infection. So that's also one more kind of an probably a lead to why we might have to consider vaccine. But I think the vaccine trials are going on in children. I think we should get some answers. And, if it can decrease the incidence of MIS-C, then I think that's worthwhile considering vaccination in children. And also from epidemiological perspective, to prevent future waves, vaccinating children would be an important step.
The perspective of Dr. Shetty, who's been treating hundreds of children these last couple of months, should be reassuring to parents who are worried about their wards. But for a more comprehensive understanding of what a third wave might look like, to understand whether policymakers might be paying disproportionate attention to how children might be affected at the cost of something else, and what the health ministry's thoughts are, I spoke to two other experts. The first, Dr. Chandrakant Lahariya, is an epidemiologist and public health systems expert who's also recently co-authored Till We Win, India's Fight Against the COVID-19 Pandemic, along with AIIMS Chief Dr. Randeep Guleria and vaccine expert Dr. Gagandeep Kang. The other is my colleague, Teena Thacker, ET's health reporter, who's been covering all aspects of the pandemic for the Economic Times. Thank you both for joining us. Dr. Lahariya, before I get into the discussion about kids and whether they're more at risk in case of a third wave, I want to start with a more fundamental question. Is another surge of COVID cases later this year inevitable?
What we need to remember that as long as there are susceptible population groups, there would be surge in the cases of COVID-19. We have seen in many countries that they had witnessed 3 or even 4 epidemic waves. Before start of second wave, while there was 78% of Indian population which was susceptible, but by the time second wave would be over, there would still be 40% or so population which will be susceptible to virus. So the only way this susceptible population pool can be reduced, either we rapidly scale up vaccination drive or a natural infection happens. So there is no doubt that India would have a third wave, a fourth wave, or maybe many more waves.
I'll in fact come to the question of vaccinations a little later, but whenever discussions about the third wave of COVID seems to come up, and these days they are coming up, a lot of emphasis seems to be about whether it's likely to affect children disproportionately. And we've also seen various state governments like Maharashtra and UP say they'll be increasing pediatric COVID care, setting up pediatric ICUs in anticipation of a third wave.
Meanwhile, staying with Maharashtra, anticipating that third wave, as you heard the Chief Minister there, and a possibility that it might infect kids more.
In fact, Delhi government seems to be taking this fight of COVID and their impact on kids quite seriously. They have now decided to form a special task force to protect children from Corona's third wave.
Dr. Lahariya, is there any evidence to suggest that children will be more at risk in the event of a third wave?
Let me be very categorical in this. There is no scientific or epidemiological evidence that third or any subsequent wave would affect children disproportionately. Let me come to the specific answer. Many countries have already witnessed a number of waves, including 4 waves, and from none of the countries we have seen that children were disproportionately affected. And even during those periods, there was no vaccine available. Second, we know and from successive sero surveys done at the national level and state level, and what we know from those sero surveys, that in all the periods or all the waves and all the states, children were infected at a similar level or similar rate as adults were. We also know that children do not develop severe disease. There is a scientific reason for that, because the SARS-CoV-2 need to latch to a particular receptors in the lungs of human beings, and these receptors are called ACE2. These receptors are underdeveloped in the lungs of the children, and that's why while children do get infected, they carry the virus in their nose and throat, but the virus does not find a way to their lungs, and that's why they do not develop severe disease. But let me also come to some epidemiological data from India. Number of Indian states and also Indian Council of Medical Research and Niti Aayog did a study on hospitalized patients. They reported their findings in which they said that in the first wave of all the cases, 4.2% were in the age group of 0 to 18 years. Now, they have also looked at the data from the second wave, and it was found that the proportion of cases in children in the second wave was around 5.8%. Now, if we look at statistically and epidemiologically, the difference in the 4.2 and 5.8% may not be statistically significant. It's only outcome of limited data collected. So there is no change and no difference. I also want to highlight that while we are hearing some leading experts talking about higher risk of children developing disease in third wave,
yes,
I think that is really ill-informed.
Now, more and more scientists are saying that once the third wave hits India, kids are going to be most impacted.
ऑक्सीजन की सप्लाई के केस में सुनवाई के दौरान सुप्रीम कोर्ट ने कहा, चिंता की बात है कि तीसरी लहर की बात वैज्ञानिक कर रहे हैं, उसमें बच्चों के प्रभावित होने की आशंका है।
क्या तीसरी लहर में बच्चों को सबसे ज्यादा खतरा होगा? राजस्थान के अखबारों में तो कुछ ऐसी हेडलाइंस छपी जिससे बच्चों के माता पिता बहुत चिंतित हुए।
What happens in the second wave? The absolute number of cases was 4 to 6 fold higher. In this way, we know healthcare facilities for all population groups were overwhelmed. Children are valued by every society and every family. So what happens that children are taken to healthcare facility little early and they are taken to a higher level of healthcare facility. So it is very likely that people working at the tertiary or advanced level of facilities, especially pediatric ICU, might have seen far higher number of cases. But that does not translate that children were disproportionately affected. It is very likely that the number of pediatric ICU are limited or pediatric facilities are limited. So they saw a slightly higher number of cases. Beyond the opinion of individual practitioners, the professional association have also examined and reviewed this situation. And even the professional associations such as Indian Academy of Pediatrics have found as a group of 30,000 practitioners that children have not been at additional risk and unlikely to be additional risk. So there is no reason to panic. The other aspect I would like to flag that if we look scientific aspect, and though virus is changing as we see through genomic sequence and there are new variants of concern, but there is no evidence that these new variants have any increased affinity for children. I believe that a few Indian states have worked or acted in hurry or hurriedly acted to set up a pediatric task forces for COVID-19. Pandemic response should be comprehensive and integrated. If the pediatric viewpoint need to be taken, the pediatricians should be part of the single task force. Sometimes there is a risk in setting up separate task force because they come under impression that they have to come up with some ideas, and that may skew the discourse and the efforts which government should be doing.
Teena, what are you hearing from your sources in the health ministry about whether the union government is already talking about preparing for a third wave? Is there any talk about, again, pediatric care and so on?
Yeah, so basically, as we all know that children are often asymptomatic and rarely require hospitalization. However, there are viral behavior that can change. So keeping in view, various disease dynamics and nature of the virus and the pandemic, the government has formed guidelines which will be made public soon. So what is happening is that there is an updated view of the situation, and this group has examined signs which were not available 4 to 5 months ago. So we will have something for the children, though we are saying that they're often asymptomatic. And an expert group, as Dr. Lahariya told, has been created to review COVID infections in children.
Okay. I'd like to come to the question of vaccines now, because one reason parents are concerned about children and COVID in the next surge is also because no vaccines have been authorized for use in India yet. And in fact, that's what one of the parents I had spoken to had told me as well.
Pfizer has come out with a 12 plus vaccine, which is not yet approved in India. And we don't know when the 2 to 11 years old, when that vaccine, I think is still under trials. If I'm looking at the scenario, it'll probably only arrive in India probably next year. And by the time the kids get it, it's another whole year of their having lost school, having lost the time playing with their friends, sports, activities, so many other things. So yes, I'm hoping and praying that this vaccine gets here sooner rather than later.
Dr. Shetty, the pediatrician that I'd spoken to, also said that one concern that's usually shared with him is that, because children will form a large population who are not vaccinated, the virus might spread through them because they're a vulnerable section of the population. Dr. Lahariya, is that a valid concern, the fact that there will be unvaccinated children and hence they'll be more vulnerable to the disease and transmission?
So we need to remember that COVID-19 vaccination is being done with specific purpose. And that purpose is threefold. One, to protect the frontline workers. And second is to reduce morbidity and mortality. For that, you vaccinate the people who are older than 60 years and then 45 plus who are with comorbidity. And third purpose is preventing the transmission. Now, what we know that children in this scheme of thing or prioritization of vaccination falls into third group where they could be useful. Vaccinating children could be useful for reducing the transmission. However, we already know that children are not at risk of morbidity and mortality in comparison of adults who are at far higher risk. That's one part. Second part is we, as I discussed earlier, through various sero survey have found that children have already been infected and recovered or did not develop a severe disease. So they are as much protected as adults without the vaccine. Merely saying that because adults are being vaccinated and children are not being vaccinated does not convey that the children are at a higher risk. We are sure that in the long run, even children need to be vaccinated. And that's why we can wait for vaccination of children. And we should also wait for the right kind of vaccines for children, which will not only prevent them from disease, but also help in reducing the transmission. And those are the kind of vaccines which, like, for example, nasal vaccines. Nasal vaccines have an advantage of reducing the transmission also.
Okay. Dr. Lahariya, I had a broader question about vaccination itself, because on Tuesday, the government had said there'll be enough doses to vaccinate 1 crore people a day.
There is no shortage of vaccines. The shortage is what you feel if you want to vaccinate the country within a month. So we are vaccinating the country. It is a large population. By the middle of the year or early part of July or in middle of July or early August, we will have more than enough doses to vaccinate up to 1 crore per day.
How realistic is this 1 crore a day target?
If you look at the current vaccine availability, which was 8 crore in the month of May, but actual number of vaccines administered was 6 crore. For month of June is 12 crore, and that on that rate or that much availability of vaccine, a maximum daily vaccination can be done is 40 lakh. We don't foresee that it will increase beyond 15 crore in July. So if India want to achieve 1 crore vaccination, which is possible, which can be done, which it can only happen when we have a sufficient vaccine excess of 30 crore a month or more. And I don't foresee that kind of vaccine availability for the country before October 2021.
Obviously, when there is a constraint of supply, as you mentioned, it's all about who you need to prioritize. But Teena, what do we know about where India is on approving vaccines for children in India? I understand that Covaxin, for instance, has begun trials in the 2 to 18-year age group recently.
Yeah. So India has started trials on vaccination for children. Like you have just shared that we have Bharat Biotech's Covaxin. The company has taken permission and are conducting trials. And then there is this trial by Zydus Cadila, which is near completion. They have conducted trials comprising like 1,000 children. And as of now, they have not seen any concern related to safety of the vaccine. We are also hearing negotiations which are ongoing between the government and global drug maker Pfizer. So if all goes well, we may get Pfizer that can be used for children. In months to come, we may have like these 3 options readily available. Like Dr. Lahariya has also said that, there is no undue burden that has been placed on the pediatric care infrastructure so far. However, there is a possible that 2 to 3% children who get infected may need hospitalization. So the government is already gearing up in terms of making vaccinations available for children.
But as of now, we don't have a clear timeline yet, right?
It's ongoing. So maybe Zydus could become the first ever indigenous vaccine maker to get a vaccine approved for children, because they are saying that their trial is almost near completion.
Okay. Teena, so apart from the emphasis on children that people are talking about, what is the government saying about broader preparations for the third wave?
So the government is going full steam at 3 levels, at the level of surveillance, healthcare system, and at community level. When we talk about surveillance, it means it will be important to ensure that testing should not go down. At present, it's like 20 to 25 lakh per day. So this needs to be maintained.
Okay.
The government is also of the view that wherever positivity rate goes up, then let's say 5%, and intense investigation will be needed. And the government is giving stress to genome surveillance. The next is healthcare systems. So the government has set up temporary corona centers which needed to be sustained. These structures which have been created should not be dismantled. It should be amalgamated with the regular system. Then the temporary structures of ICU which have been created should be maintained. So they are all working on all these things, like how to ensure that these structures which have been created as of now should be maintained. So this period which is called maybe a lag period where maybe the cases will go down, this period should be used for training of doctors and personnel in intensive care. So the point is that whatever we have learned during this wave, we need to implement it. Make in India oxygen concentrators need to be strengthened. Last but not the least, then they say about the community level, surveillance. There is a need for vaccine encouragement because, you'll see that as the number of cases are going down, people will have this hesitancy. So the need to have proactive social mobilization and inculcating the COVID appropriate behavior has to be there.
Doctor, my final question to you. In 2020, India was better off compared to many younger countries, but that, of course, changed dramatically in the current wave when hardly anyone's been left unaffected one way or the other. Now, you've made it very clear that children are not disproportionately at risk. So what should we be focusing on to deal with future spikes? And how should we be building on the failures of the last few months to face a future surge?
So I'm not a big cricket fan, but let me give you a cricket analogy for this one. So like it was like a test match where India went as an underdog before the first wave. And it did fairly well considering the constraints. However, once the first inning was over or first wave was over, the team started partying, really celebrating their victory. And when it came to the second inning of the test match, they crumbled quickly and the other opposition won. And that's what the situation has happened in COVID-19 pandemic. We celebrated little early. We did not learn the lessons or did not realize that the other side, the SARS-CoV-2 can come with vengeance.
दुनिया के कई नामी एक्सपर्ट्स और बड़ी बड़ी संस्थाओं ने क्या क्या कहा था। भविष्यवाणी की गई थी कि पूरी दुनिया में कोरोना से सबसे प्रभावित देश भारत होगा। आज भारत दुनिया के उन देशों में से है जो अपने ज्यादा से ज्यादा नागरिकों का जीवन बचाने में सफल रहा है।
So it was premature celebration. The country started thinking that we don't need to strengthen our healthcare infrastructure or it could be achieved without much of the effort. One of the key learning is that you need to have a ready healthcare system which cannot be prepared overnight. So preparedness is the best approach for pandemic responses. And no health system can be prepared overnight to respond to the pandemic. So all those systems need to have a surge capacity. Second learning from both the waves, in my opinion, is that pandemic require a knowledge and evidence-based response. Mm-hmm. It requires that the technical experts are engaged, including independent experts. The political decision should be minimum or should not be taken. Third learning is that we should have a decentralized approach for operationalizing public health response. The fourth learning is the timely, reliable data. Fifth learning is that, and that is most important in my opinion, that if we want to fight epidemics and pandemics, then we need to have a three-way partnership. The partnership between policymakers and bureaucrats, and then second group is a technical expert, and third is a community members. Unless all three works together, unless each one of them do their bit, we cannot fight the virus.
Thank you, Doctor. And as you mentioned, waves sound inevitable. So all the more important that these learnings that you mentioned are implemented.
Thank you very much.
Before we sign off, I'd like to leave you with Dr. Shetty's advice to parents who are apprehensive about what the future might hold for their children in the case of a third wave.
It's a difficult time for everybody, and the second wave has been really, really unfortunate. The first wave probably was, it did affect, but then it was more psychological in terms of the fear of not knowing what is to come, hearing all the stories happening across the world. So there was a lot of concern. But then, thankfully, by God's grace, it didn't seem to affect that much. But the story, second wave, has been absolutely in contrast. It's been very difficult time for most of the families, especially those who have lost their loved ones. Now, when we hear a lot of these stories in the media, and there is tremendous amount of anxiety levels about what's going to happen in the future. Now, the great difficulty for us as doctors also has been, managing this anxiety among families. And what this anxiety does is, try to take lots of medications when they're not required. And even currently, even with adults, what we're noticing is a lot of people are taking too many medications when it's not required, which are not proven, not useful. I think many of that stems from the fact of anxiety. People want something, some medicine, some to control. So I think we should not feel so anxious. And I think the experience, at least of having learned from first wave and second wave, that at least in children, it's not been that bad. And what we have noticed also last 1 year is, in the process of bettering the immunity, overfeeding and a lot of excessive weight gain. We've got children who have developed diabetes at 11 years, 12 years, who have crossed 100 kilos at the age of 12, 13. These are not a good and healthy trend. A child who should gain a weight of around 2 kilos in a year is gaining around 10 kilos in a year. This has been a common trend. In fact, it's going to create a pandemic of obesity. And that's what's been happening in children. Psychological problems, problems related to pandemic. I just remember one child admitted today is around probably around 10 years. And the only reason for getting admitted was that the family was tested COVID. They're on day 3 of illness. They got a blood test in her and the CRP was told to be high. The girl at 10-year-old, she got so anxious knowing about CRP report. That's, and then they had to come to the hospital because child got anxious. That's where we are now. The anxiety of reports, anxiety of half information, anxiety of something going bad. And I think it's really important to stay positive, have a positive mindset, and lead a healthy lifestyle.
You were listening to the morning brief from the Economic Times, and I'm Indulekha Arvind. Today's episode was edited by Anjali Venugopalan and coordinated by Shashwat Mohanty. Write in with feedback to the morning brief at timesgroup.com and do spread the word about the episode on social media if you liked it. The morning brief airs every Tuesday, Thursday, and Friday. Thank you for listening. Stay safe and have a great day. All the clips used in this episode belong to their respective owners. You can find the credits in the description.